Liberia has a fragile health system. There is a low doctor-patient ratio, with about 500 doctors for the country's 5 million people. Many have little to no access to healthcare facilities, particularly in the rural areas. To help tackle these problems, Liberia launched its Community Health Workers Program following the 2014-2015 Ebola epidemic. There are 4,000 community health workers or community health assistants, CHAs, like John Flomo, bringing health care literally to the doorsteps of people in remote communities in all of Liberia's 15 counties. Hello. Their primary role is to diagnose and treat children under 5 for pneumonia, malaria, malnutrition, and other health problems.
Yes, it's positive, malaria.
They also focus on community health education and disease surveillance and prevention.
Our training in how to prevent other diseases that can affect our community people. The measles, the polio, we make sure our children take the vaccine on time.
They are now also leading COVID-19 prevention and vaccination campaigns in their communities.
To encourage my people, I was the first, as you can see my card, I was the first to do my vaccine.
In a country with a low doctor-patient ratio, the community health workers are really the main provider of primary care for thousands of people in Liberia.
In my catchment area, I control 277 households.
506 persons in my catchment community.
Cases they cannot treat, they refer to the nearest health facility.
Because of their quick referral, since I took over 2019, I never experienced any maternal mortality death in my facility.
Indeed, since the community health scheme officially launched in 2016 in the wake of the Ebola epidemic, it has made startling progress. About 70% of Liberia's 700,000 rural residents now have access to care. A study published in August found that community health workers now treat 45% of all malaria cases among children under 5, with that figure rising year after year. Many things explain the success of the community health program in Liberia. First, the CHAs come from the very communities they serve and are nominated by the people in those communities, creating a strong bond and trust between the CHAs and their communities. All of the CHAs must have at least a 6th grade education, pass a written test, and then go through a rigorous 4-month training. Another key to the success of the community health program is the very close supervision of CHAs by Community Health Services Supervisors, CHSS, who are registered nurses, physician assistants, or certified midwives.
Okay, what's the museum of routine physical?
No wonder the Liberians who run this program take great pride in its success.
So we are working with all of the stakeholders to ensure that this Liberian team succeeds in the implementation of this project.
But despite the successes, there are some problems.
The major challenge right now we are having is the availability of drugs.
For now, though, thanks to the community health program, Liberia's poverty-stricken, remote and rural communities are benefiting from improved access to health care.
We are here. Maternal mortality, family planning,